Welcome to the Institute for Human Services Annual Medicaid Compliance Training. My name is Kelsey Acor and I am the Medicaid Compliance Officer. Today you are joining me to participate in Medicaid Compliance Training. I will provide an overview of IHS Compliance Program, compliance policies, procedures, and expectations. Please ensure that you take the exam at the conclusion of the training to receive training credit. Medicaid is a health care program that assists low-income families or individuals in paying for medical care. Medicaid is funded by the federal, state, and local government. The Institute for Human Services has implemented and maintains a compliance program as required by New York State Department of Health and the Office of Medicaid Inspector General. IHS, its board of directors, administrators, and management teams are committed to delivering quality and efficient patient transportation services to the highest standards of ethical and professional business conduct. Maintaining full compliance with all applicable state and federal laws affecting the delivery and payment of healthcare-related transportation services, including those regulations that prohibit fraud, abuse, and waste of healthcare resources, is of the highest priority. The compliance plan is applicable to all billings, payments, medical necessity and quality of care, governance, mandatory reporting, and credentialing. A complete copy of the IHS compliance plan and compliance officer contact information can be located on the IHS website. We have already reviewed what Medicaid is. Now I would like to explain what Medicaid fraud is and how we can recognize it. Healthcare fraud is not a victimless crime. It impacts all taxpayers, recipients, and providers. Fraud, abuse, and waste is defined as accepting gratuities from a vendor of any kind, including but not limited to free service, steering Medicaid transportation to a specific vendor for any reason, knowingly dismissing a vendor's action of providing a higher level of transport than is needed, a peer, supervisor, or manager requesting you to perform a non-compliant function even if you do not carry out the request, sharing personal information of a recipient for personal benefit or with any non-IHS employee not involved in recipient's care, not in the hours of scheduled work hours, engaging in collusive agreements with other vendors, providing inaccurate codes for service, and falsifying, modifying, or changing trip logs that are not yours. Do not feel that you have to know if the activity is fraud, abuse, or waste. If you have concerns, it is your responsibility to consult with your compliance officer. Your compliance officer will have the ability to answer all of your compliance-related questions. The compliance program guides our processes and procedures regarding medical travel and assists us in monitoring for continuous improvement measures so that we can continue the great work that we do every day. The compliance plan, policies, and procedures apply to all IHS board members, employees, volunteers, and interns equally. The law requires that all IHS board members, employees, volunteers, and interns involved in the oversight, direction, or service delivery of the Medicaid program be screened through the OMIG exclusion list, review and sign the Code of Conduct, and participate in Medicaid compliance training on an annual basis. The screening tool is designed to determine if anyone involved in the supervision, direction, or service delivery role in a Medicaid-funded program has been excluded. If we discover that a person has been excluded, then we will not be permitted to bill for the services that they provided. Compliance training will be provided to all IHS employees within 30 days of assignment and annually. The Code of Conduct is a set of principles that outlines your responsibilities and guides proper business practices while employed or volunteering at IHS. The Institute for Human Services Governing Board, personnel, volunteers, and interns are committed to professional excellence. All IHS affiliates shall maintain high standards of ethical conduct and will comply with all applicable laws, regulations, and third-party payer program requirements. The Code of Conduct reviews anti-discrimination, anti-retaliation, customer service expectations, financial relationships, claims processing, billing, and payments, contract management, confidentiality, and reporting violations of policies, procedures, laws, and regulations. The Code of Conduct details have been reviewed with you in person, and a signed copy may be located in your compliance file. As a Medicaid service provider, it is our responsibility to work diligently to identify possible risk areas. Our identified risk areas are documentation requirements, billing errors, exclusions, and trip log errors. We monitor these identified areas by conducting monthly internal audits. The audits consist of reviewing the driver trip logs for accuracy and comparing the trips to the MAS assigned trips and the Medicaid billing. The audits allow us to catch errors within the time frame that allows us to correct without having to begin the formal OMIG self-disclosure process. Our compliance committee is comprised of the compliance officer and 4 additional directors that are not involved with the Medicaid transportation program. The compliance committee meets quarterly to review the audit results, corrective actions, and produce recommendations. Now that we have learned what fraud, abuse, and waste of Medicaid funding is, we need to learn how to report fraudulent activities. As representatives of the Institute for Human Services, we must practice honesty and integrity in fulfilling our responsibilities and comply with all applicable laws and regulations. The Institute for Human Services is committed to maintaining the integrity of its business operations and the anonymity of good faith reporters. The Institute has an open door policy and suggests that employees share their questions, concerns, suggestions, or complaints with their supervisor. If you are not comfortable speaking with your supervisor, or you are not satisfied with your supervisor's response, you are encouraged to speak with any member of the management team. Supervisors and managers are required to report complaints or concerns about suspected ethical and legal violations in writing to the compliance officer, who has the responsibility to investigate all reported complaints. The Institute for Human Services has established 3 methods for reporting compliance issues. The fillable form on the IHS website that can be emailed to compliance@ihsnet.org or labeled confidential and mailed to IHS at 50 Liberty Street, Bath, New York 14810. Once the compliance officer receives a complaint, he or she will begin investigating the complaint. At the conclusion of the investigation, the compliance officer will prepare a report with recommendations to prevent a reoccurrence if warranted. All complaints, records, and reports will be kept confidential as permitted in the course of a thorough investigation. Anyone reporting suspected fraud is protected from retaliation under the Whistleblower Act. The Institute for Human Services prides itself on delivery of personalized, compassionate, and professional transportation services. All volunteer drivers are trained in HIPAA compliance, have their MVR reviewed, participate in the LENS program, are cleared through the Medicaid exclusion database, and have a background check completed prior to accepting assignments. The Institute for Human Services only accepts Medicaid transportation trips from Medical Answering Services, New York State Transportation Broker. The Institute for Human Services is prohibited from accepting Medicaid trips from any other source. All trips assigned to the volunteer driver by the Institute for Human Services employees will be reimbursable. It is not permissible for a volunteer driver to schedule appointments directly with a client. If a driver has the need to cancel a scheduled transport, the driver is required to call IHS Coordinated Transportation to cancel the trip. It is not permissible for drivers to trade trips or ask another driver to take their trip. The driver trip logs are a very important piece of the volunteer driver program and must be accurate. All drivers are required to complete a trip log prior to and after each trip. It is imperative that the trip log contain the full printed name and signature of the driver providing the transport, attesting that the referenced trip was completed, your driver's license number, your vehicle license plate number, the Medicaid enrollee's name and Medicaid identification number, the date of the transport, both the origination of the trip and the time of pickup, both the destination of the trip and the time of drop-off. The trip logs will be verified with the MAS assignments and billing and will not be billed if any of this information is missing. The Institute for Human Services will attest to its billing only when there is sufficient documentation to verify that transportation was provided to a medical appointment. Trip logs must only be completed for authorized trips that occurred at IHS's direction. Our volunteers are the lifeline of what we do in our communities, and we value their service to the communities in which they live. If a mistake is made, please draw a single line through the mistake, initial and date, and then write the correction below. Please do not use whiteout or attempt to blacken mistakes. Please direct all compliance-related questions, comments, and concerns to Kelsey Acor at the contact number displayed. These requests may also be made by mail to the attention of the compliance officer marked as confidential to the address provided. Please click on the link to be redirected to the compliance quiz.